Christine Elliott, our Deputy Premier and Minister of Health, with us now. And Minister Elliott is very, very busy these days. We can very well understand. The situation is so grim, so tense. People are scared. People are confused. But we are trying our best to bring best to best information to you. And Minister is with us now. Minister, welcome to Radio Parvasi and good morning.
Hello, a pleasure to join you. Thank you.
I understand for the last many days, now I would say weeks, you are so busy. So any information you would like to share with us, first of all, before I start questions?
Sure. Well, I would like people to know that we, from the Ministry of Health, that we do have a plan that was developed a number of years ago after SARS, and we learned a lot of lessons then and developed a series of procedures and protocols to follow in the event that we experienced another pandemic, such as we're seeing with COVID-19. And it's been a plan for organization of health resources and extensive communication so that everyone knows what's happening in the sector. So we do have a command table that's set up within the ministry that comprises all aspects of the healthcare system, and they have the ability to increase resources to sort of ramp up in terms of what's going on within our hospitals, how do we acquire extra equipment and resources, and that's what we're in the process of doing. So I just think that it's important for your listeners to know that that is in action right now.
Minister, I heard that during SARS, we purchased lots of masks and other kind of stuff, but because of the time period, they have been discarded now, and we are hearing that we have shortage of masks and other such kind of material required at this time. Will you clear that?
Well, I think that it's fair to say that the entire world is looking for masks and protective equipment right now, but we certainly have a supply here. We are being assisted by the government who's helping us obtain additional supplies in Ontario from other parts of Canada. And we're also working with businesses in Ontario who are able to produce some of that equipment or that we used to get from other parts of the world, perhaps from China. Some of the swabs come from northern Italy, where they're also seeing a huge problem with COVID-19. But we are looking at businesses in Ontario to produce these goods. And people, businesses and individuals are very cooperative and very helpful to us.
Minister, I was talking to someone in China today. We print our directory, annual directory there. They were telling us that biggest difference they could make was by wearing masks. So they were surprised to know that it is not mandatory in our province to wear these masks. So it can make a lot of difference. We are taking all kind of measures, but shouldn't we put stress on this thing also?
The masks themselves the masks that you see most people wearing don't actually provide any further protection from COVID-19.
Okay.
It's the N95 form-fitting masks that healthcare workers wear that are helpful, but most of the masks that you see people wearing on the streets actually aren't helpful.
Another complaint, I would like to give you all that feedback which we are getting from our listener, from the community. It took a lot of time to start these test centers, and still we don't have enough test centers. And again, we started testing very late, though we have already started it. So will you clear on that also?
Yes, we have been doing assessments since the beginning, but a number of them were done in hospital emergency departments. We now have separated them from those departments and created separate assessment centers so that the people who are in the emergency departments for other reasons than COVID-19 will get the assistance that they need and not be exposed to the virus. But we have also opened 27 separate assessment centers, some of which have drive-through facilities, such as you've seen in places like South Korea. So we are getting some good assistance and ideas from other parts of the world, and we're very pleased that we've got these separate assessment centers running now. But we have always been doing the assessments.
Are we providing enough equipment and tools to our frontline workers, Minister?
Yes, we have enough equipment and tools for our frontline healthcare workers. It's really important that they be protected. so that they can, first of all, continue to do their work, but also so that they won't transmit the virus to other people. So it's very important that they have the masks. In some cases, they have to wear the protective clothing. Sometimes face shields are necessary if they're doing certain procedures to make sure that droplets don't fly into their faces. So that is a really important part of our efforts to try and flatten the curve and stop the spread of COVID-19.
Yeah, Minister, as I said in the beginning, there are so much confusion, so much panic in the community. But I'm sure, being Minister, as you are working day and night, your team is trying its best, government is trying its best, all level of governments, they are all trying their best to keep people educating. Anything at the end you would like to tell, because we are listening, we are hearing, we are reading so much stuff on social media which is not reliable, which is not credible. So, being Minister of State of our province, I would like you to give message to the community. What should they do? How they should keep themselves safe?
Well, there is a lot of speculation out there. Social media has all kinds of rumors. I think it's important for people to look at the facts, the actual medical facts. We do have a website out there at the Ministry of Health. It's ontario.ca/coronavirus, where people can check to see what our Chief Medical Officer of Health has to say about what's going on with COVID-19. And that if people want to be in touch about their own medical symptoms, there is a self-assessment tool on the website. They can answer questions to see if they have signs of COVID-19. If they are still concerned after doing that, they can then either call Telehealth Ontario, and the information on the number is available there, or they can call their family doctor. The family doctors can now do telephone consults, or they can be in touch with their local public health unit. So there are many ways that people can call to get specific, actual, real medical information about coronavirus. And we are going to continue to provide that to all Ontarians on a regular basis. We update our website twice a day, 7 days a week. So we will have the latest information available there for all of your listeners.
Minister, you have that phone number handy with you, or we can get it later on?
The telephone number for the telehealth is 1-866
1866
797
797
0000.
0000. It's very easy to even remember. 1-866-797-0000 is the number to call. I'm sure these lines must be busy, but you can keep trying and you can get information on that also. Minister, thank you so much. And I understand you have lots of responsibilities. Your team, your ministry is working day and night, and we would love to have you again next week on the show so that we can update our listeners again.
Thank you so much for allowing me to join you today.
Thank you so much, Minister.